Talk about the squat. I know you hear a lot about it, but a lot of people don't break down where the proper squatting position is and what the benefits are. So we have Dr. Stacy. We're going to talk about first a good starting squat. So you start with your feet slightly past your hips, angled outward a little bit so you get a little bit more of a stable base, making sure your knees are going to point over your toes. And make sure your shoulders are in line with your hips and your head is looking straight forward. You want to picture almost somebody going from your glute area, bringing that straight down and making sure that you're not wavering front or back and then slowly coming back up. So this works for hips, knees, and ankle mobility, but also core stability as well in there. So as you get a little more advanced, you can bring your feet a little more towards right where your knees and your hip in line and bringing your toes a little more forward in there. But again, you're going straight down. You're not wavering forward or back, keeping that chest up. And also make sure while you're doing squats that you're breathing. When you're not breathing, especially when you add weight into it, that's where a lot of disc damage can happen. So another modification we can do is we're going to grab a yoga or exercise ball. We're going to go against the wall. This is for patients that feel like they're leaning too far forward or they feel like they're weight shifting. And this is also a really great one for just coming off of pregnancy and really working on that ab and that core strengthening again. So you slide slightly down. Again, you want to be mindful of those knees and the ankles, that you're coming straight down as beautifully as Dr. Stacy is doing. And she's also making sure she's keeping those shoulders back, and you don't want to be leaning forward in there. So that's a modification. Now another one is a lot of people that are having an issue with that hip hinge and hinging at the waist. You can literally sit into the chair. So you bring and you sit back, and you can sit all the way down and then bring it back up. There's a little more sway to this, but it gets that motion in there. And especially if somebody's new to exercise and really hasn't formed how to do a squat, this is a great way to really work on that hip hinge and bring those hip back and down and keeping those knees and ankles, because we don't want to add injury. We want to improve to not have any further injuries.